What do you do when simple remedies like diet, exercise, and medication aren't enough for your osteoarthritis pain? Today, we're exploring advanced treatments from specialized injections to surgical options that could dramatically improve your quality of life. Living with osteoarthritis can be difficult, especially when the pain, stiffness, or immobility become unbearable. While lifestyle changes and basic treatments help many people, sometimes you need more powerful interventions. In today's video, I'll break down the latest advanced treatments for osteoarthritis, including targeted injections and surgical solutions, so you can make informed decisions and find relief from your joint pain. Let's get started. 1. Cortisone Injections. One common advanced treatment option is a cortisone injection, also known as a steroid injection. Cortisone injections rapidly reduce joint inflammation, significantly decreasing pain and swelling. They're typically used in larger joints like knees, hips, or shoulders. Patients often see relief within just a few days, and benefits can last from several weeks up to several months. It's important to note, though, that these injections are generally limited to a few times per year to avoid potential joint damage. But if cortisone doesn't last long enough or you're looking for another option, that leads us to Number 2. Hyaluronic acid injections. Hyaluronic acid injections, also called viscosupplementation, work differently from cortisone. They inject a lubricating substance similar to natural joint fluid directly into the affected area. This improves cushioning in the joint, reducing friction and pain. The treatment usually involves several injections over a few weeks, offering relief that often lasts longer than cortisone, sometimes up to 6 months or more. If injections still don't provide sufficient relief, a more advanced, cutting-edge treatment you might consider is platelet-rich plasma therapy. 3. Platelet-rich plasma therapy. PRP therapy is gaining popularity as a powerful natural treatment for osteoarthritis. Doctors draw a small sample of your own blood, process it to concentrate platelets and growth factors, then inject this platelet-rich plasma into your affected joints. These platelets promote healing and reduce inflammation. While many patients report meaningful improvements in pain and joint function after PRP treatment, multiple sessions might be necessary to see optimal results. Another exciting therapy on the horizon for osteoarthritis is stem cell treatment. Let's talk about this next innovative approach. 4. Stem cell therapy. Stem cell therapy is a groundbreaking regenerative treatment option. It involves extracting stem cells from your own body, typically from fat or bone marrow, and injecting them into your affected joints. These cells can potentially regenerate damaged cartilage, reduce inflammation, and significantly decrease pain. While stem cell therapy is still considered experimental and not universally available, early studies show promising results for long-term relief. However, if all these advanced injection therapies fail, you may need to discuss surgical options with your doctor. 5. Arthroscopic surgery. Arthroscopy is a minimally invasive surgical procedure where the surgeon inserts a tiny camera into the joint through small incisions. This allows the surgeon to visually inspect the joint and perform repairs, such as trimming torn cartilage or smoothing rough joint surfaces. Arthroscopic surgery can provide significant relief, especially in cases where mechanical issues like a torn meniscus or loose cartilage are causing pain. But sometimes, arthroscopy isn't enough, especially when joint damage is more extensive. That's when partial joint replacement becomes a viable choice. 6. Partial joint replacement. In a partial joint replacement, surgeons remove only the severely damaged portion of the joint and replace it with metal or plastic components. This preserves much of your healthy bone and cartilage, allowing for faster recovery compared to full replacements. Partial replacements work particularly well for knees and hips, especially if osteoarthritis is confined to just one part of the joint. Recovery is typically quicker, and the results can dramatically improve mobility and reduce pain. If your joint damage is extensive, however, the final surgical option you may want to consider is a total joint replacement. 7. Total joint replacement surgery. Total joint replacement surgery involves removing the entire damaged joint and replacing it with artificial materials, usually metal, ceramic, or plastic. This procedure is considered the gold standard for severe osteoarthritis when other treatments haven't worked. Although recovery takes longer and involves significant rehabilitation, many patients experience dramatic pain relief and restored function, allowing them to resume a much more active and fulfilling lifestyle. In just a moment, I'll quickly summarize each of these advanced treatments and help you figure out how to discuss these options with your healthcare provider. But before we recap, if you're finding this helpful, here's something quick you can do right now. Take a second and comment below which of these treatments surprised you the most. By joining the discussion, you'll help others in our community who are looking for solutions to osteoarthritis pain. And while you're down there, tapping that like button would mean a lot. It helps YouTube spread this information to others in need. To quickly recap, here are the 7 advanced osteoarthritis treatments we discussed today. Cortisone injections for rapid relief. Hyaluronic acid injections for joint lubrication and cushioning. PRP therapy for natural healing through your body's platelets. Stem cell therapy is a regenerative, cutting-edge treatment. Arthroscopic surgery for minimally invasive joint repair. Partial joint replacement to preserve healthy joint tissue. Total joint replacement surgery is the definitive option for extensive joint damage. If simpler treatments aren't enough, don't hesitate to discuss these advanced options with your healthcare provider. The right choice can drastically improve your quality of life. If you found value in this video, please consider subscribing to our channel. We publish helpful, practical health videos every single day. And to make sure you don't miss out on life-changing tips, treatments, and advice, turn on your notification bell so you'll always stay updated. Next up, don't miss my video, 5 proven ways to reduce joint pain naturally at home, linked right here on your screen and in the description below. Thank you for watching. I'll see you in the next video.